DFLers in the House and the Senate joined forces with the announcement of a new bicameral caucus to promote the adoption of a universal health care system in Minnesota.
When we decided to run for office and we were running our campaigns, we heard a lot from our constituents about wanting to see a comprehensive, universal coverage health care plan for Minnesota.
Health care is a basic human right. And we have a responsibility to ensure that everyone in our state can get the care they need. Unfortunately, the employer-based healthcare system in place now was not designed with this goal in mind. Its initial purpose was to give employers a way to attract workers during World War II wage freezes. And while this was appealing to workers, the health of employees was not the primary motivation, and that shows today.
Healthcare justice is a major racial and economic justice issue for our state. We see huge racial disparities between our BIPOC Minnesotans and their white peers when it comes to healthcare outcomes. The infant mortality rate, for example, is disproportionately much higher for Black babies, and that's simply immoral. Part of why we see these racial disparities is that under this employer-based get what you can afford system, BIPOC communities simply are not receiving as high quality of care as their white neighbors.
Nearly 2 years in a global pandemic has highlighted the necessity of this. Not only is it the humanly just approach for everyone to have access to quality health care, but it's a matter of public health and safety. The Minnesota Health Plan would be a single statewide plan that would cover all Minnesotans for all their medical needs: prescription drugs, vision and hearing care, mental health care, dental care, chemical dependency and substance use treatment, medical equipment and supplies, home care services, and nursing home care. It would allow patients to choose their doctors and care providers. It will reduce costs by negotiating fair prices and cutting administrative bureaucracy, not by restricting or denying care.
Senator Jennifer McEwen is a co-chair of the Health Plan Caucus, and I spoke with her this week. You said that your constituents have asked for transformative change in healthcare. How is the Minnesota Health Plan transformative?
Well, thanks for that question. I think that the biggest way that the Minnesota Health Plan is transformative is it takes it out of being driven by profit, right? There are certain areas of our lives where the profit motivation does not serve us well. So we have things like firefighters, police, roads, bridges. We have an infrastructure that really helps everybody in our society. It's not a pay-to-play kind of thing. These are just services that we provide. So the biggest way that the Minnesota Health Plan is a game changer for people is all of a sudden we have a health care system that is driven by care. Care that healthcare providers, doctors, nurses, nurse practitioners, other practitioners within the system, psychologists, all of the people within the care system, the care that they determine is necessary for patients, working with those patients. Right now we have a system where doctors have to make calls to insurance companies to get clearance to give the care that they know that their patients need. We have a for-profit middleman in the center between patients and care providers. And what the Minnesota Health Plan does is take that out of the equation so that care providers can just directly help their patients and give them the care that they need.
Now, you mentioned the middleman right there. So what is the role, if any, for traditional healthcare insurance under this plan?
There is no role for healthcare insurance under the Minnesota Health Plan. So you could imagine you wouldn't have to have a health insurance company any longer. That doesn't necessarily mean that health insurance would completely disappear. It certainly is possible that private companies could offer plans, but they wouldn't need to for all of the healthcare needs that people need in their lives, because the Minnesota Health Care Plan provides comprehensive care. It covers vision, it covers dental, it covers mental health care, it covers hearing. It really is a comprehensive healthcare system for Minnesotans. So it doesn't cover things like plastic surgery or sort of elective procedures that aren't medically necessary, but in all other respects, it's a comprehensive plan.
Now, this plan isn't new. It was actually first put forth by Senator John Marty. He wrote a book of the same name, Minnesota Health Plan, that was published in 2016. He's long been an advocate for healthcare reform. As a co-chair of this new 60-member caucus to promote change, which tenets of the plan most resonate with you?
Yeah, that's such a great question. There are so many reasons why we should adopt the Minnesota Health Plan, or, preferably even at the national level, a Medicare for all system. It's hard to choose just one, honestly, because when I ran, this is my first term as a new state senator, and when I was running for office, I did hear so many of my constituents contacting me, asking, please, in your role and in your run for office, please help us advance the Minnesota Health Plan. This really is what we need. And there are reasons like for businesses, the system that we have right now for small businesses is just crippling. Small businesses want to provide healthcare for their employees, but they can't. It's just too expensive. It's also really reaching a breaking point with our municipalities. So my hometown of Duluth, the city council across the political spectrum from conservative to more liberal unanimously voted in favor of a resolution asking Minnesota to adopt the Minnesota Health Plan. And that's for cost reasons. Some of the more conservative members on the council are thinking of those businesses, and they're just thinking of Duluthians who need healthcare, right? It is just, it's too great of a burden on our city. It's too great of a burden on our community as a whole to have these costs continue to go up because people are trying to make a profit. And there's only so much you can do. So those are big, huge reasons. Also, I love the idea that we separate healthcare from employment status. So what that does, it frees people up in a way that we haven't really seen before. And we heard somebody at our rally today who was a small business owner talking about how this could really be a sort of renaissance and a business incentive and a driver of innovation and development in a way that we haven't seen for many, many years, because people all of a sudden won't be tied down to jobs that they don't want to do just for healthcare. It's immensely freeing. You would know that you were covered regardless. So you can do the kind of work that you really want to do. If you want to start a business, you can start a business. People just won't have that burden and then that tie down of needing to be situated employment-wise and work-wise in a way that they have those just basic healthcare needs met, because those will be provided for by all of us, for all
now,
of us.
Critics are going to say that this is too expensive, that taxes will go up. Many people believe that we do need a for-profit system to ensure competitiveness and to reduce waste. How would costs for services be established?
Well, I love this critique because what we have now is way too expensive. We spend more money on our health care in this country than any other of our peer nations throughout the world. I mean, I think we spend over twice of what our neighbors to the north in Canada spend on health care. So when we're talking about high cost of health care, what we have right now is a bloated administrative system that is really, really unnecessary and also causes just great harm to so many people in the delivery of care, in their finances. Some of the stories we heard today at the rally were just heartbreaking, that nurses told of the patients that they had were helping and the things that those patients were going through in terms of their finances, in terms of having come in late because people are avoiding care because they are worried how they're going to pay for it. But the cost of care, this is another piece that we want to be able to negotiate for prices. We want to be able to control and interact with the market. So actually, in this speaks to another issue, is that this isn't socialized medicine, the Minnesota Health Plan. This is, sometimes people may misunderstand that. This isn't a model like the VA.
If I could just interject just right there, because Senate Majority Leader Jeremy Miller was asked today about the Minnesota Health Plan, and he said that members of his caucus are not in favor, and he called it a, quote, government-run bureaucratic health plan. So briefly, before we have to go, how do you counter those arguments that this is socialized medicine or it's bureaucratic government or the like?
Sure. He's just wrong about the plan. He should read it. He and talk with me about it. I'd love to have a meeting. I'll reach out to him and see if he wants to talk. But it's not a government-run program in the way that the VA is a government-run program. This is a healthcare system that will still allow private healthcare providers, so hospitals, doctors, clinics, all of the healthcare providers in Minnesota to deal directly with their patients and for patients to deal directly with those providers. And as a community, we take the insurance company role out of the middle of it so that they can deal directly with one another. And we make sure that the system serves everybody and we oversee it in a way. And again, I love to compare it with our other public goods like firefighting, like police, because these are just essential goods that we should value in our society. And I think that sometimes things get labeled as big government when actually, as in this case, it will provide more freedom to people, more freedom to individuals, more freedom to businesses. This really will open up so much if we can adopt the Minnesota Health.
Senator Jen McEwen, I want to thank you so much for your time.
Thank you so much for having me.